Well, this is the first year for this Leadership Award, and it really is part of our 10th anniversary celebrations to really celebrate the ongoing transformational change that's happening in the Northwest LHIN and the creative, innovative leaders that have worked together in partnership to ensure that the people of the Northwest LHIN have access to really excellent care.
My background is nursing, and I started out actually my career in Thunder Bay. At each point along the way, I managed to learn a little more about cardiovascular services, how they were delivered in other areas, and I guess formulate some ideas around Thunder Bay.
Well, I think the award would convey to our partners and also to her colleagues in the hospital the prodigious amount of work that she has put into the development of cardiology here in general and now specifically this cardiovascular program. And this was all led by Arlene and her team. And it's been a tremendous body of work, and I'm quite sure without her efforts we would have not got the approval that we did in June of this year.
I believe that what it does is it gives all our cardiovascular patients, it gives more options. In the past, patients, you take what's there, you take what's available to you, especially in real time. This provides a much wider breadth of options, which means we give patients A, more choice, and B, we're better able to match the right treatment plan with the right patient. So having those services available really means a lot for our patients. I think they're going to feel that they can play a bigger role in selecting what they want and getting the service they need. And I think most importantly, the best advice I can give is just be patient. Don't abandon the vision, because everything does come in time. It's slow, and what you think will take a year might take 10 or more, but it's worth it in the end.
So we ended up with quite a large steering committee that was really representative of all the different sectors of healthcare in Thunder Bay, including the Canadian Mental Health Association, certainly primary care was invited to the table as well. It was a really interesting collection of people that probably would not have had an opportunity to sit together and have a conversation about healthcare without the opportunity that the HealthLink provided.
And those collaborative partnerships have allowed all of us to really get to know each other, to develop more trusting relationships, to understand each other's business and work together for the benefit of the patients.
We're starting from the same point, and that is to improve patient care. But often we come up against some barriers, and so when we do, it's really been interesting with the HealthLink that we can access providers, organizations that are not technically considered healthcare that can come and help and provide those services. A particular example of that is early on we recognized that while we have EMS for emergency transportation, we don't have a non-urgent transportation system, or we didn't at the time. As a result of the HealthLink partnerships, one was created and we were able to seek out some funding for it. So it's those kinds of things. Normally that would have been a barrier to care, and now we've been able to address that by introducing other partners.
What HealthLinks has done is followed a philosophy of truly listening to what the HealthLink providers work on is what is important to them for better outcomes for their health. And we've been able to see great outcomes by that. We've heard from our patients that they feel very well supported and that they've had a better healthcare experience. And we've seen decreases in the amount of times they access the emergency department and the amount of inpatient stays that they have. We truly come to the table with the patient in mind and put the patient in the center of all of this and truly listen to them, that you can achieve health system transformation for those patients.